We got somebody new right now, Eric Cantor, the congressman from the great state of Virginia. The House Minority Whip joins us right now from our nation's capital. Good morning to you, sir.
Good morning, Steve.
We just had Robert Gibbs on a couple of minutes ago. He said we're going to hear a lot about the government-run public option tonight. That's extraordinary because there are a number of people in the president's own party who think that that's radioactive.
Well, you know, I think that's really the box that the president is in, and Pelosi and their party's in right now, and that's really what the American people are going to want to hear. I think it's time for specifics. It's time for this president to stop any suggestion of the fact that he's not listening to the American people. And what we have heard over the last several weeks is the American people are fearful that a government option will turn into a government replacement of the health care system that we have, and that's what I think people are really waiting to hear tonight, Steve.
And Congressman, it sounds like that government-run public option is really the sticking point, but it sounds as though two senators, Ben Nelson and Olympia Snowe, have come up with what they think will be a silver bullet, and that's the trigger plan. Excuse the pun. Let us play for you what Robert Gibbs, how he explained the trigger option, and then get you to respond.
As I understand, the trigger that's being proposed on Capitol Hill is that if certain reforms aren't met in a region of the country, if a region of the country is dominated, as I said, like Alabama is, by one health insurance provider, if there aren't enough options for people in that region, that would trigger a public option.
So not a national plan, just in select pockets of the country. What do you think?
Well, listen, Allison, the devil is in the details when you start talking about things like a trigger. And it's all about whether we're going to hear the president say that Washington knows the kind of health care that Americans deserve, and Washington is going to take control of the decision-making as far as the design of those programs. And if that's the route they're going to proceed, then the public is going to realize their fears are real, that there is going to be not only a government option, but even with a trigger, with a construct like that, there's going to be a replacement of the health care system that most Americans have and like.
Congressman, we just heard from Robert Gibbs. Where are the Republican ideas? And we also know that Senator Mitch McConnell said the status quo was not acceptable. Throw out a few ideas.
Well, absolutely. And this line that somehow the Republicans don't have any proposal is just untrue. I think they know it. It's tired. It's old. They really need to get off of that. I mean, number one, we've always said we agree with the fact that we've got to do something to avoid the situation where individuals with pre-existing conditions can't get health care. We agree on that. Let's start there. We also agree on the fact that if you lose your job, you should not necessarily lose your health care. You got to be able to take your health care with you.
Sure.
And those are things that we can begin on. And I'd like to hear the president start talking about some of the things we agree on rather than the things that we disagree on, because there are a lot of common sense things that we can accomplish together if they would finally say that we're not about having the government design a health care system here.
There's a story out, I think it's from ABC, Congressman, that said that yesterday when Harry Reid and Nancy Pelosi went in and met with the president, the key word was urgency. Apparently the president told Speaker Pelosi and Senate Majority Leader Harry Reid that it is important for them to pass health care reform bills soon. Do you think that the reason the White House is saying we got to do this fast is because public support for his big plans is absolutely cratering?
Well, I mean, there's no question that the public support is cratering because people are fearful of this plan. But, Steve, don't you think that the American people would rather see it done right than done soon?
Absolutely.
I mean, that is the essence of the message we've heard from the American people over the last month. That's why this plan has cratered. It is somehow disconnected with where most people are in this country. Most people don't accept the status quo. I don't think anybody here in Washington accepts the status quo. But let's begin to start to institute real reform, not rush it through. Every time Washington and Congress rushes something through, it messes it up even further.
Right.
Look, this year alone, you look at the stimulus bill. That's a case in point right there.
Yeah,
almost $800 billion.
And we'll leave it right there, Congressman, because we're going to talk to you more right around the bend. But first, Cantor, he is the House Minority Whip. Congressman, I know where you stand. You've kind of made it clear. We've talked to you because you've been kind of the point person amongst the Republicans, along with Mitch McConnell, on this. But what do you hope to hear tonight in the speech that might get you onto your feet to clap for a Democratic president?
Listen, Brian, I hope to hear that we really can work together, that we're going to set aside this notion that somehow we need a government option, because I do believe that the American people get a government option will lead to a replacement of the system of health care that people have and, frankly, most people like. So if we set that aside and we say, look, there are some things we can do to work together. The pre-existing condition issue, the issue of portability, of making sure you don't lose your insurance if you lose your job. Let's start there. Let's also say, look, let's get the lawyers out of the examining room. I mean, that's a no-brainer, and somehow the president has backed way off of that issue, but it's something that I believe can bring some cost savings to the table. But, Brian, what we've got going on right now is Nancy Pelosi, the Speaker of the House, has said that we are going to have a public option in the House plan. Well, if that's the case, obviously, Republicans aren't going to go along with that.
Well, Majority Leader Steny Hoyer, Congressman, says if they don't have a public option, I could still vote for it. So that just shows a crack amongst the hierarchy. So if they give in on that, what will you give in on?
Well, listen, we need to stand up in principle and say, look, Americans like the fact that they make the choices with their doctors as far as health care is concerned. If we can start with that premise, if we can also then start with the premise that we don't believe we should go about spending over $1 trillion and adding to the deficit and putting this country on the brink of bankruptcy, if we can start with those basic prerequisites and hear from the president tonight that he gets that, I believe that we can work together on some of these things.
Congressman, you're overstating it. The new plan under Max Buck is just $900 billion. So, again, you're inflating it. Congressman Eric Cantor, I look forward to seeing what you have to say the next day. We'll do the post-game report with Eric Cantor possibly tomorrow as we look back at the speech tonight. Thanks again.
Brian, thanks.